A colonoscopy is a procedure where a flexible scope is placed gently through the large intestine of a patient under heavy sedation so that they don't feel the examination. It's advanced all the way to the top of the colon, which depending upon the person's size is anywhere from 3.5 to 4.5 feet. It's slowly withdrawn through the colon so that we can identify polyps, which are precancerous lesions, and remove them when we can. When we perform a colonoscopy, we're looking for polyps. These are precancerous growths on the wall of the colon that if we remove in time, years in many cases before it becomes a cancer, we prevent the cancer from occurring. These may be very flat, subtle lesions on the wall of the colon. That they may be larger and on a stalk, and we will use a snare or sometimes just a biopsy forceps, which is like a tweezer, to either snip them off or just pull them off of the colon wall.
Colonoscopy is a pretty cool test. You can look at the entire inside of the colon. That's where a colon cancer starts, is a polyp hanging down into the colon. And they have a camera and they can snip things out of there and send it for biopsy and the like. So it's a very thorough look at the inside of your colon.
The technology has advanced dramatically since I've been a gastroenterologist. In the early days of colonoscopy, we peered through a small hole at the top of the scope and got a very limited view of the colon. We now have high-definition scopes that project pictures onto big screen TVs where we can identify a 1 to 2 millimeter polyp and remove it. Although every procedure has risks, colonoscopy is a relatively low-risk procedure. A perforation or the making of a hole in the wall of the colon is the most worrisome complication. It occurs nationally about 1 in every 3,000 procedures. Patients may have bleeding as a result of a polyp removal. That may occur at the time of the colonoscopy or up to 10 days after the exam is performed, but is generally self-limited and can be managed. Rarely aspiration or inhaling of stomach contents may occur. That's why it's important not to eat anything after midnight the morning of your exam. And also in rare cases, medication reactions can occur. Our data strongly suggests that colonoscopy with polyp removal is the best screening examination to prevent colon cancer and to detect it in its early stages. However, other options are available. These include a stool DNA analysis, which is marketed at this time by Cologuard. This looks for DNA that is shed by tumors within the colon. It is the essentially first generation of that test, and it has some merit, though it is almost certainly not as good as a colonoscopy at detecting polyps in their early stages. Virtual colonoscopy is also an option. This examination uses a high-definition CAT scan that reformats the image into a 3D image of the colon. And it is good at detecting polyps, but unfortunately, if a polyp is found, the patient has to go through a second preparation in most cases. And there is a radiation dose with every virtual colonoscopy. Stool for occult blood analysis or fecal immune testing is also used, but that does not have as high a sensitivity for the detection of colon polyps in their early stages as colonoscopy does.